With us, of course, an honor that we have Colonel Dr. Ashvini Goel, who is the President of Telemedicine Society of India. He had given us the time to be here and understand the situation and tell us what's going on about here. He is a larger than life picture, and as we can see, he is the convener and secretary of TSI and NCR chapter also. He is rather the founder, member and president of the society. He is been applauded to many groups and platforms where he has been forming. One of them is also being the National Task Force of Swachh Bharat. He's also been involved in many government projects, and we can see a long list of it. We welcome Dr. Ashvini Goel, and we are here to listen to his words of wisdom.
Well, good evening, ladies and gentlemen. I bring you greetings from the Telemedicine Society of India. And I'm especially thankful, as I said, to Mr. Bharadwaj for inviting me as a guest speaker. I'm greatly honored and humbled to be able to interact with the enlightened audience on this occasion. As we all know, it is all ophthalmologists here or people connected with ophthalmology. And we are in the business of correcting the great debility and disability caused by blindness. And blindness, as we all know, is not only a major disease, but a great social trauma, which affects an individual not only physically and emotionally, but also socially and economically. It's a major global problem. India was the first country in the world to launch the national program for control of blindness. However, there is still a huge burden of blindness in India. India suffers from a huge healthcare divide due to the shortage of doctors, with most concentrating their practice in the urban localities. Additionally, the inadequate infrastructure of roads, telecommunication, transport, and financial status of the patients makes it even more difficult to provide healthcare in the rural areas. So teleophthalmology has come up as a new branch of telemedicine that offers solutions to this serious problem. At present, some advanced ophthalmology centers are engaged in teleophthalmology projects like the renowned Shankar Nethralaya, Arvind Eye Hospital, and so many efforts which are being driven by the dynamic personality of Professor Natarajan. These have proven successful both in rural and the urban primary and secondary healthcare centers. Teleophthalmology is an effective screening and a management tool for a range of acute and chronic ocular conditions. With improvement in image processing and better integration of patients' medical record, teleophthalmology is fast becoming a more accepted modality, all the more so in circumstances where social distancing is inflicted upon us, as we all know, has happened during the current pandemic, where the social distancing norms have been put in place. So recommendations and policies from the government and national health organizations combined with social distancing have led to exponential increase in the telemedicine use. Teleophthalmology has great potential to be integrated into ophthalmic care delivery. In the emergency room, teleophthalmology can be utilized to triage patients and diagnose common ophthalmic eye diseases. Ophthalmology practices can utilize real-time medicine to conduct many parts of an in-person exam. In cases where more complex diagnostic tools are warranted, a model incorporating telemedicine and focused in-person visits may still be beneficial. Innovative technologies emerging in the market allow for increased remote monitoring, screening, and management of adult and pediatric patients for common eye diseases. COVID-19 pandemic has created a demand for healthcare delivery that limits in-person examination and entails potential viral exposure. Teleophthalmology allows ophthalmologists to continue caring for patients while keeping patients and the physicians safe. Although challenges still exist, the pandemic has accelerated the adoption of teleophthalmology. As a result, teleophthalmology will play an integral role in providing high quality, efficient care in the near future. And to this end, Teleophthalmology Society of India has an onerous mandate to bridge the existing healthcare divide in the country as far as ophthalmology is concerned. To achieve this, I wish to recommend to this August Assembly to focus on three aspects of healthcare delivery: to develop standards, protocols, and SOPs for provision of ophthalmic care, to ensure capacity building of healthcare workforce, both doctors and allied healthcare professionals, including innovative and entrepreneurial activities in teleophthalmology. And lastly, to train care providers in the practice of technology-enabled healthcare. And a great number of the optometrists, as we were talking a little while earlier, this great pool is available to us to enhance the workforce as far as ophthalmology is concerned. Dedicated and focused training of this humongous numbers of ophthalmology workers can create wonders. As you all know, this is very much in alignment with the avowed aim of the Telemedicine Society of India to promote and encourage development, advancement, and research in telemedicine technology and its associated fields. Being a not-for-profit scientific society dedicated to creating awareness of telemedicine at national level and carrying out scientific activities to promote telemedicine, TSI is recognized by the Government of India as a lead organization promoting telehealth in India. TSI aims to establish a pan-India telehealth network to facilitate delivery of healthcare by online teleconsultations. It is heartening indeed to see that the current president of the Ophthalmology Society of India and the president of Teleophthalmology Society, Padma Shri Dr. Natarajan, is also present today in this forum. And we look forward to his pearls of wisdom a little later. I look forward to many ophthalmologists becoming members of TSI and TOSI as well. It may be pertinent to mention that Dr. S.S. Badrinath, as I was telling some people a little while earlier, the doyen of ophthalmology and founder of Shankar Netralaya, is also a founder and the first president of Telemedicine Society of India. As the president of TSI, I wish to organizers all success. I assure you that TSI as an umbrella body will extend all possible guidance and the required support to all those who profess to practice teleophthalmology in India. Heartiest congratulations once again. Jai Hind.